Hey Periscopers! This is Jacqueline Darna. I'm the CEO and medical inventor of the NoMo Nausea Band and obviously a anesthesia care provider. I apologize guys for being a little bit late, but the good news is we're here today to talk about what is acupressure, how you can actually utilize it, and why it's important to kind of put this into practice and or play because of the fact that it actually elicits the same response as medicine, but without any harmful side effects, which is nice. All right, so the first thing is, if you could just take a look, there is so many different reasons for the actual modality of the physiology when it comes to acupressure. Now that was just for nausea itself. So let's look at the actual acupressure point that we have for nausea because I did invent the NoMo Nausea Band. It's the first and only natural way to stop nausea, vomiting, and headaches instantly. So it's actually a band that's infused with essential oils that is placed 3-finger distance from the first wrist crease in between your first 2 tendons. When you apply pressure at this point, you're actually eliciting a response which is underneath of the actual median nerve. When you apply pressure at greater than 5-minute intervals, believe it or not, your body produces anti-nausea hormones. They actually produce hormones that are also called beta endorphins. It's a really fancy word for saying just happy hormones. These happy hormones are transferred into your brain that actually stay for 12 to 24 hours after the NoMo Nausea Band has been removed, and it continues to circulate. Now, talking about other acupressure points, there's other things. If you're really stressed out and you need to make sure that you kind of calm yourself and decrease your heart rate, that you can do that very easily. There's actually it's called the H6 point. So it's actually 2-finger distance in between and it's closer to your radial artery. The last one is L8, which is located 4-finger distance from the outside called your lungs. So again, that's L8. NoMo Stress and NoMo Cough and Cold, which will be coming out with different essential oils utilizing acupressure, will actually be utilizing the combination of the two. The beauty of it is NoMoNausea.com is great for instant relief of nausea, vomiting, and headaches, as well as the side effect of none. No medications, no need. I'm going to put this up one more time, or you can take a look at NoMoNausea.com and you can find out more about acupressure in general. Does anybody have any questions about acupressure and how it can actually help to alleviate common things such as headaches, migraines, nausea, vomiting, problems with bronchial constriction, so somebody who's got a severe COPD, or people who just have really bad stress. Again, there's different acupressure points that you can tap, but the most important thing is that you actually apply constant pressure for greater than 5 minutes. All right, guys, thank you so much for all the hearts. Any other questions that I can answer about a specific acupressure point and what ailment it has? All right, well, I hope that that answered any and all of your questions. Again, please go. Yes, cancer patients, absolutely. The P6 point, which is located 3-finger distance, is great for avoiding post-chemotherapy nausea and vomiting. So that, again, for chemotherapy, go on to NoMoNausea.com and you'll actually see we have a chemotherapeutic band. It's called the NoMo Nausea Med Plus band. And believe it or not, it helps to relax and alleviate the stomach as to relieve it before. We actually have cancer patients who are now able to gain 5, 10, 15 pounds because they're able to smell the band and get instant relief. Thank you so much. Again, I love the wonderful comments. Any other questions in specific to an ailment and how acupressure can help? Anyone? No. All right, again, my name is Jacqueline Darna. I'm the CEO and medical inventor of the NoMo Nausea Band, an obvious anesthesia provider. Thank you guys so much. Again, join us next week, Wellness Wednesday, every Wednesday at 6 p.m. And I'd be more than happy to answer any and all of your medical questions. All right, guys, very nice to see you guys. And check it out, NoMoNausea.com.